Hi friends. Um, Today I'm going to discuss about something regarding lactation. This the information I'm sharing with you is from book Breastfeeding and Lactation, Human Lactation, third edition by John Riordan. It's a nice book. It's very informative, simple, and it is good. Means whoever is preparing for LC examination, this will be very helpful. So I strongly recommend to read this book if you have. Okay, let me share some key concepts about breastfeeding. So for the mothers who is going to deliver, so the best time means antenatal period, they get maximum education, and if they can find a support system after the delivery, if they have problem with their lactation, if they can find out if there is any supporting system around them, or whomever, maybe a family member can support them, or a lactation clinic, or breastfeeding clinics, or a peer group, or breastfeeding support mothers. So there are so many breastfeeding support in the community they can look for, and the mothers should take initiative to get as much as information about the pregnancy as well as the lactation. Okay, so as I said you, the best preparation for breastfeeding is to learn as much as possible before the birth of baby and to find a support system. Then there are some people think like that nipple rolling, toughening of the nipple, making them tough, that is helpful. No, none of these practices is helpful, and those practices should be avoided. Then neonates are initially alert. So the after the birth, neonates are alert in the first 2 hours. That is the golden time to initiate breastfeeding. So uninterrupted skin to skin contact 1 to 2 hours. So uninitiative breastfeeding within 30 minutes to 1 hour. Then babies go into a deep sleep, may go into 20 hours. So it will be hard to initiate. This is the best time within the first 2 hours. Okay, there is no complications. The breastfeeding should take place during the first hour. Okay, then when you initiate all these things, you have to make sure that baby sorry, the mom is she get her privacy and a comfortable position and optimal latch. These three things you have to, especially you have to focus on, and these are all basic skills necessary to assist mothers and neonate in early breastfeeding. So this is a learning experience for both for mom and babies. So those you have to focus on. So give her comfortable position and give her enough privacy, and make sure that the baby is correctly hold and good latch. Okay, that's it. So care during the labor and birth and post care are impact of birth. So if a mother had a long labor or a traumatic labor, or it was quite stressful for her, so that those all things can impact breastfeeding. So emotional support, physical support, all those things we have to keep in mind and support those mothers, because it is easy to give up if little support in right time help may help to prolong or sustain breastfeeding. So make sure that you make the mom as comfortable as she can with your support. Teaching correct position for breastfeeding varies according to the practitioner. Correct position is as yet not evidence based. So whatever is comfortable for the mom. Some maybe their sideline is okay for them. Sometimes cradle hold, sometimes cross cradle. So whatever is comfortable for the mother. So mother, that is the best thing. You can make the mother to practice. When baby is not latching in the breast, it is important to feed the baby, establish the mother's milk supply, and find hands-on help to correct the situation and encourage skin-to-skin contact. Maybe the baby is sleepy and not feeding, but the thing is that we should keep on, the stimulation should go on. Tell the mom to express or hand massage breast, keep that stimulation on, then only the milk production will come. So first 2 days it is hormone driven, like endocrine, and like the pregnancy hormone drops as the placenta removes and the pregnancy ends. So then in 2 days, that is the it's a hormone driven, still it's there. So and the hormone level drops, pregnancy hormone level drops. So then it turns to autocrine, endocrine versus autocrine. After the third day onwards, it is autocrine. Autocrine means as the baby empty the breast, the stimulation goes, and it as it get empties, it refills. That is autocrine. Something like when the breast is empties, the signal goes, it is more filling is required. That is something like autocrine. Okay, so in the endocrine versus that period, so 1 to 2 days, it is not mandatory to breastfeed means for stimulation or something is required, is mandatory, but still it's better to start is a colostrum there, and because for the milk production, more milk coming, that is in the autocrine. After the third day onwards, the more milk is coming. Okay, but still to start breastfeeding from the early hour is the best practice and best thing. Okay, now when a baby is not latching, that I said, if cup feeding is done carefully, it has been found to be as safe as bottle feeding. However, infants who are cup fed spill more milk than infants who are bottle fed. So bottle fed, so there is less chance for leaking, but cup feed, you will see that babies are spitting more milk. But even one bottle feed, like with a nipple, like a silicone nipple or something, that can keep the baby away from breast, because that is something easy the baby get. If you give even one bottle, can keep the baby away from the breast, then they may not latch. So as much as possible, you need some patience to give baby cup feeding, or means if it is something convenient, if we are not skillful, then only go, if it is necessary, only start with the nipple feeds, bottle feeds. Okay, otherwise best is directly from breast, and the baby moms can express in between, or after feeding they can express and keep that for later use, or when she's away or extra some is required. Sometimes maybe there is some difficulties to make for breastfeeding, that time she can feed that one. Okay, during the first 2 days, infant who are breastfed and the infant who are cup fed ingest less milk than infant who are bottle fed. So when you compare, if you give a baby bottle feed in first 2 days, they'll drink a lot. So actually their capacity is up to 20 ml. This is 7 to 14 ml, 7 to 20 ml. Some book varies. So that is the stomach capacity, the fist size of that baby, that is their stomach capacity. But if you give a bottle feed baby, they may drink even 30 ml or 20 ml. Okay, so that's it. If cup feed, if you compare a cup feeding and breastfeeding and a bottle feeding, a bottle feed baby, when you feed baby by bottle, they drink a lot. Okay, in the first 2 days. New parents need to watch the baby, not the clock, to determine when the baby is ready to feed. Feed the baby at the earliest sign of hunger. Crying is a late sign of hunger. So many places still in practice that you look every 2 hour or 3 hour you feed, but no, that's not the one. When you are hungry, see, for example, like adult like us, when you are hungry, you want to eat. Not like that at 2 o'clock I eat, 1 o'clock I eat my lunch, or at 8 o'clock I brush my. You need hunger. You have to be hungry. Yeah. So tell the parents to the sign, feeding cues, like baby is waking up from sleep, or you will see the baby might be sleeping in the crib, but the eye balls are moving inside, then stretching, moving head side to side, taking fingers. These are all early feeding cues and early to meet. So if mother see, the clever moms, they pick up this early feeding cues and try to feed the baby at least the medium calling. But if these are not picked up by moms, then the baby go into a stage of crying, that is late. So late, it is difficult for to feed a baby when the baby is crying, because their tongue is at the top, so it is difficult to get a good latch. So first, a crying baby has to be consoled, then put on breast. So the smart parent, smart mom should pick up the baby when she notices the early feeding cues. So not look the clock. Then and new parent. Then healthy infants born between 34 and 38 weeks need special help and careful frequent follow-up, and these babies tend to breastfeed poorly. So this is a little preterm, late preterms. Not 38 is not preterm, but 34 to 36 they have a little, you may feel some need some extra attention for these babies because they may feed poorly, so you need extra attention there. Short term use of a silicone nipple shield in certain situations like a nipple version, low birth weight infants can preserve the breastfeeding relationship while the baby learn to feed. So um, baby moms have some maybe a mild inverted nipple or something, so nipple shield can help out. So don't give up this also. It's not only called the breastfeed, it's called a chest feed as well. So yeah, with the help of nipple shield we can still continue with the breastfeeding, and little patience with baby, and baby will continue on breastfeeding, and you don't have means a mother can continue breastfeeding with even if it's a mild inverted nipple or some difficulties in nipple. Only true inversion is about only 3 to 4 percentage. That also yeah, they can still, they can express feed and they can do some alternative if they wish to feed. Okay, but still always they can pump and give their breast milk. Healthy infants born with that I said already. Short term use of silicone, that also. Generally accepted guidelines for hypoglycemia in full term infant is serum glucose concentration of less than 30 milligram per deciliter is the first day after birth, or less than 40 mg per deciliter of the second day. Invasive procedure for determining glucose levels can be avoided by early skin to skin contact between mother and baby, frequent breastfeeding and close clinical observation. So some babies means as a protocol in the institutional protocol. So what we do is some gestational diabetes, or infant of a diabetic mom, or insulin dependent diabetic mother, or large for gestational age or small for gestational age, or some now there are some other like a mother on labetalol. This all babies is they are all automatically they go for blood sugar check. So for 12 hours, if it is SGA for 24 hours, like that blood check going on, it will be going on. So if you do skin to skin and keep baby enough warm and frequent feeding, can avoid these hypoglycemic attacks. Because if the baby's extremities are cold or the baby is cold, then there is a chance that blood sugar level maybe you will get a low blood sugar reading. So doing good skin to skin and regular feeding can avoid such complications. In my experience also, a significant number of NICU admission are prevented only by doing skin to skin and frequent breastfeeding. Okay. Now, generally speaking, women who deliver by cesarean birth breastfeed as frequently as for long as those who have vaginal birth. Special concern related to breastfeeding are pain, control, comfortable positioning, and early initiation of breastfeeding. So the moms delivered by cesarean section, they are means they are in pain, they have difficulty to take positions and difficult to get a good latch. Those mothers are less, sometimes less percentage of cesarean moms are doing breastfeeding compared to vaginal birth babies. Okay, normal breast engorgement starts at 3 to 5 days after birth and then slowly recedes over the first 2 weeks. During normal engorgement, mother's breast tissue usually remains compressible, thus enabling the infant to suckle comfortably and efficiently. Early and frequent breastfeeding is thought to prevent severe engorgement. See, as first and second day, the breast may not get filled up because there is a structure called as a tight junction. There is gap, and there is a colostrum. It's a very small amount only it's produced, but as she entered in the third day of postpartum period, letdown reflexes started, more milk production is started, so the breast gets filled up, and if it is not removed, the engorgement happens and it will be painful for me. If the still that is compressible and soft, the if baby drinks and drains, it will go comfortably. So mostly some mothers, especially primary mothers, they'll end up having engorgement and they'll have painful experience, they give up those things. Maybe sometimes they some even as an emergency case they come in the hospitals. I have seen severe engorged breast. She was crying, she came in the emergency, there was no service in the emergency, and the next day morning she ended up in breastfeeding clinic with the severe engorgement, and she was crying like anything. So you know, so if they know that if they put the baby on skin, what is this called, frequent for breastfeeding or hand expression, something to relieve their pain that point, or some hot compress they do. So those things, information, that's what I'm telling, getting information in the antenatal period itself is important. If something like that if it happens, what is a remedy they can do at home. And so getting information is so important. If the mom is not skillful that much, but if she has information, they can practice, because after the deliveries everything is in a practical phase. So the getting the information in antenatal period during the pregnancy, that is the best time to get it. Okay. Then excessive intravenous fluid during labor can lead to postpartum breast edema. The technique of areolar compression can help reshape the breast area so that the neonate is able to latch onto the breast. So during labor, mostly many places patient will be kept, will be kept in orally, and IV fluids will be running. So in that case it will be difficult. Maybe there is lots of fluid retention in the body and it is edematous, the breast is edematous. So like that is some what is that, some then areolar compression. If areolar compression can help reshape the breast and initiate feeding. Then hand expression is a time honored skill that cost nothing, is easy to learn and easy always available. So mom can do if it is it's a good thing to start with. If nothing is there, if colostrum is not there, but she can still stimulating, like if, especially when the baby, if the baby is separated from mom, if the baby is in an ICU, or it is away from mom for any reason, then she can stimulate breast and hand express. So that's a good thing, and keep the stimulation on and let the lactation start. Early discharge does not appear to affect breastfeeding if there is a postpartum care and support. So some means if some hospital discharge early, the mom and baby, as they are sending early home, some after 24 hours after normal birth. In our hospital in 2 days cesarean will stay, in 24 hours the normal vaginal birth will stay, and others, if any indication, then only they'll stay for long, or otherwise no. If they have enough knowledge and skill and support system, there is no concern that the early going home is a problem for lactation, so they can go easily. Then basic and priority discharge teaching include teaching the mother her baby's feeding cues, how to latch her baby into the breast, how to know the baby is getting enough milk, and she can call for help with the breastfeeding. So just you, there will be, means most of the hospital have a checklist what all things are discussed with mom. So different positions, how to get a good latch, you know that the baby is getting enough milk, so how to monitor the intake and output, all those things. Okay, so and if physiological jaundice development and the baby is satisfied or not, all those things will be discussed with the mom before going home, and she get If there is information booklet, give to her. So because you discuss a lot of thing at a time, but them it may not be going into their memory or in brain, so give them handouts and they can refer it later on. Okay. Then marketing or discharge packet reduce the length of exclusive breastfeeding. However, they do not exert a large influence on breastfeeding duration as some other determinants. Okay, that is all about some tips I said. I'll come with another video some other days as I was going through this chapter as I'm preparing for IBCMC exam this year. So I thought of sharing some information with you. Thank you guys for watching. I'll come with another video in maybe within 2 3 days. Okay, bye.